DocTalk is brought to you by MERCK Animal Health, the science of healthier animals.
Hey folks, Dr. Dan here. Thanks for joining us today on DocTalk. We're going to have a great show. It's one of those shows that we enjoy doing. It's talking about calving disorders. Dr. Matt Miesner from Kansas State's Veterinary Health Center is going to be here. It's going to be a great show. You're going to learn lots. I'm going to learn lots. We'll see you after the break.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Matt, welcome to the show.
Glad to be here.
Folks, this is Dr. Matt Miesner. He's here at the Kansas State College of Veterinary Medicine. He's over in the Veterinary Health Center, where he is an associate clinical professor in the Department of Clinical Sciences. And Matt, we're going to talk about calving, and we're going to talk about, and that's all right, you're a clinician, the beeper's supposed to go off. That's when we get somebody that's in live, in action, he's on call, it's probably a dystocia, we're going to have to take a break. No, just joking.
Sound check.
That's right. Let's talk about calving and normal calving as things progress. You know, I think that the one thing we always kind of lose track of time, we lose track of what's going on with that heifer, but there are different stages, right?
Right. None of them can read. I've not met a cow that could read a book yet, but there are some predicted times that we need to look at, and times when we need to act, and times when we just need to leave them alone as well. So, you know, we go through stages, and there's 3 stages of calving, and the whole process is what I would call is prep, push, and placenta. You know, it makes it pretty simple. So the first stage is stage 1, which is prep phase, and that's leading up to it, and all the things are getting relaxed, and the cow's getting ready to make enough opening to get this calf ready to go. And then there's the push phase, which is the actual labor, and then that should be pretty quickly. And then the third one is the placenta, and so after that the placenta should pass, and we should have some time for the cow to get ready to raise the calf. You know, so
let's get into that prep phase, and I assume that's when she starts to go off by herself and different behavior and
isolation. You know, some people, if you see them in a stall, if they're confined, they'll kind of nest, they'll kind of do those kind of things. Cows are experienced at this thing, and it's pretty fast, and sometimes we don't even notice it. You know, one day she looks okay, next day she's got a pretty good udder, and everything's starting to look relaxed, and man, you're ready to go. Heifers, you know, learning the ropes, it could take weeks, you know, sometimes for this to prep. Udder filling, ligaments loosening, all that stuff, so it takes time.
And then, so that has a real varied response, and there's no hurry there because we're getting cervix dilation, and once the cervix gets dilated, then we enter that push phase.
Right.
Is there more of a time once they start pushing?
Yes. So again, cows most of the time, sometimes it's just a cough. Out comes the calf. So within a half an hour, once they start, that water bag breaks and they start pushing in the cow, they should be out. I mean, pretty quickly, within a half an hour usually. And then the heifers, you know, they take a little time. Got to dilate and loosen things up, and it could take up to an hour. But the bottom line is, in that push phase, if things aren't happening pretty abruptly within an hour we need to intervene. And sometimes it takes a heifer longer to get it out, but I like that hour kind of cutoff.
Cool. Well, now that we've kind of gone through normal calving, that'll lead us in right after the break. We'll talk about some of the dystocias.
Right.
All right, folks. Thanks for watching Doc Talk. More with Dr. Matt Miesner on call after this.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Kathleen Morris is the 5th generation of a Texas ranching family, and her mother is a veterinarian, so it was natural for her to choose a career in veterinary medicine. Her main interests are in equine dentistry and podiatry, but she also loves working with small ruminants and livestock. After graduation, she will spend the summer working in Alberta, and then return to Texas to work full-time in a mixed practice.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from MERCK Animal Health.
Do your cattle struggle with pink eye, BRD, or another disease? Contact Newport Laboratories for a customized solution. Our custom-made vaccines are produced using the specific diseases found in your area. These USDA licensed vaccines offer potential cost savings on vaccine and labor. Contact your veterinarian or Newport Laboratories the next time your cattle are in need of a custom solution. Newport Laboratories custom-made vaccine, because every situation is different.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Miesner, and we're talking about calving disorders or normal calving, and now let's move into dystocia because we got to the push phase. We've waited 30 minutes and nothing's happened. And as a producer or a rancher, what's the first thing we need to do?
Frequent checks. I mean, having a plan. I mean, is it going to be now? We've watched her and we've seen if she's going to have problems. Is she showing signs of stress? Is she really laboring on this situation, or is is she just kind of pacing? But having a plan for restraint. Getting her caught, squeeze chute. Set of panels or a rail that can be opened up someplace to safely get her restrained, and then do a good exam. And most of that is having a good visual and maybe even palpating exam, kind of cleaning her up and making sure everything is coming through the birth canal okay, if you're comfortable with that. If not, that's the time to say it's time to call the veterinarian and have them do that. But, having that ability to have her restrained safely certainly helps the veterinarian be more efficient if need be at that point in time, and can get a good exam. Make sure everything's positioned right, nose, front feet, and everything's coming through the canal. Sometimes intervening there is the easiest way to go.
Yeah, and that's the other thing. I think that we overlook the restraint part, because there's nothing more frustrating than a cow she's trying to have a calf. She doesn't know what's going on. She's getting up, she's pushing, she's getting up, looking around to see where the calf is. And then when you show up as a veterinarian or as a producer, you're trying to figure out, how am I even going to check this thing?
Yeah.
And the safety of you, your family, your practitioner, and the cow is important.
Right. Yep. And having a way to easily, efficiently get her in there too. Not having to work her too hard to get her to a point to restrain her. So planning ahead, that's part of the calving problems that we're looking at. So as far as these dystocias go, and then there's plenty of producers out there that are have delivered tons of calves, but there's always going to be that one that you're going to go, something's not right, and things that we see as veterinarians, or especially in the clinic, is the odd ones. And I've seen things where we've had twisted uteruses or uterine torsions, and some of these conjoined twins, and the bizarre things that there's still the most experienced producer sometimes goes in and just says, whoa. At that point in time, if you have the ability and you have a good relationship with the veterinarian, it's probably a good idea to call them too.
I thought they just, the experienced ones called us when it was snowing or
Yeah.
when it was raining was more than they had seen.
But it's always good to call early because, veterinarians at this time of year might be traveling the ridges doing a lot of this, and so it's nice to have them be able to make a plan. They might be on their way by that direction.
So when you reach in there, you want to feel 2 feet in the head.
Right, yep. And then we got to figure out which feet they are. And if you look at the way that feet bend, the front's knees and fetlocks bend the same way, and the backs are opposite. And so there's a bunch of just systematic exams that we do at that point. And knowing if that calf's going to make it through that birth canal, it might just be a giant calf or head turned around. There's a whole bunch of different situations that we can get into and make a plan. And at that point, we want to see progression. And so once we start, then I go half an hour time.
Cool. We're going to take a break, folks. When we come back, more with Dr. Matt Miesner on calving problems.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vet Medica, Inc.
I'm Dr. Kip Lukasevich with Production Animal Consultation. Today's BQA tip of the day is proper implanting technique. It's a really important implant that we give these animals at arrival or delayed implanting, whichever it may be, is that we do a proper job of doing it. Implants today give you a rate of return of about $30 to $60 and sometimes up to $80 pending the implant. And so it's just really important that we get that implant in correctly. It's really important that we have disinfect the ear on arrival. So if we have a clean bucket for just the initial wash and then disinfection for just a final scrub, and then we actually have our implant gun where we have the disinfectant that we should always change that disinfectant every 200 head or in between pins and keep that fresh. And then disinfect your needle each time in between each animal. If you skip off the ear, also disinfect that needle. Don't just go on an implant. And so that's your tip of the day.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
If my calves start healthy and stay healthy, I've got a good shot at making money. That is why I trust Clostrix. It gives my calves the protection they need until their own immune systems kick in.
Calf raisers trust Colostrix colostrum supplements. Colostrix is USDA licensed and proven effective. When your money is on the line, trust Colostrix.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner, and we're from the College of Vet Med at Kansas State University. We're talking about calving disorders or getting that live calf on the ground, and we're talking during the break. You have 3 goals.
Right. Number one is, to get me a live, viable calf, so we want this to be efficient and easy on the calf. Number 2 is preservation of the welfare of the cow, so pain, welfare, distraughtness, all that kind of stuff. And then 3rd is maintaining her future reproductive soundness. So we don't want to injure things bad enough that she's not able to breed back. So I have those 3 goals going into each one of these situations.
Yeah, and we want to keep her in the herd, and you know, and then the feedlot dystocias, we're worried about the heifer, not necessarily the calf.
You know,
because we're in the business of producing beef.
Right. And so the best way to do this is to be efficient. And so I look at my watch. You know, time flies when you're having a good time, and I want to be having some sort of progress about every 15 to 30 minutes. So if I need to get a leg up or a head's turned around, I want to have that lined up and ready to go within 15 minutes or half an hour. And each stage, whether it's breech, you know, we have a tail or we have a posterior, I just want to be sure that I'm getting things moving out the back end efficiently. And if I'm not, then it's already been discussed as to what is plan B. Is it a live calf? Is it a dead calf? When do we go to a cesarean? And it's been shown pretty often, if we have a decent facility, a sooner decision for a cesarean is usually a good one. Cow's in a better shape, calf is in better shape. All in all, if we have the right situation, you know, for a cesarean. So
well, when we're talking about the beef prices,
that's
where they're at. A cesarean section, folks, is nothing on the cost for what getting a live viable calf that you're going to sell that's going to be $1,600 at the time of weaning.
Right. Yeah, and if you're able to do a good, efficient C-section with a cow in better shape, her chances of breeding back are a lot better than waiting too long. You know, so keep it going.
So a cesarean doesn't necessarily preclude or decrease the reproductive efficiency.
Right. Not if it's done efficiently and the decision's made a little bit earlier on, and you have the right setup to do it. It doesn't do that to it.
And a lot of times, if you're wanting to help that veterinarian or help the cow, sometimes just loading her up and bringing her to the veterinarian, you know they're going to have the right facility, you know they're going to have the equipment there. You know, you're dealing more on your time schedule. It's something that I see more and more is the hauling clinic.
Right, and more efficiency, so a veterinarian can do more at once. You have all the medical equipment that you need to revive that calf. You know, a whole bunch of different medical interventions you can do at the clinic. Plus, everybody's warmer and drier and all that kind of stuff. But in the end, everybody benefits from that, and you do see more haul-in type situations.
Cool. Well, let's take a break. When we come back, let's talk about taking care of that cow and that calf after the calf hits the ground.
Good.
Thanks, Matt. Thank you for watching DocTalk. More here after the break.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
I'm Jackie Moore, Joplin Regional Stockyards, Joplin, Missouri. You know, we're a family-oriented business here at Joplin Stockyards, being in business here since 1977. When I was 18 years old, I went to work at the stockyards, and through the years, we've developed a facility that will sell over 400,000 cattle a year in the 4-state area here. We're big on family, we're big on promotion of our own products, and I think when you talk about the beef checkoff and those kind of things, we got to promote what we do as an industry worldwide and globally. You know, it ain't like it used to be, where it's all regional, it's globals.
Going forward from here for the next generation, I think it's really important that we keep people informed of the quality of beef we're raising and the different things that we're doing to strive to make this a better industry. And I really think that with the beef checkoffs help, we can keep everybody on the same track to let them know that we're raising a safe, good product every day of our lives. You know, I think as we move forward, I think, you know, the beef checkoff dollar, you know, we're going towards the research, make these ready-made beef product meals, you know, and I think that's going to be a crucial part of our business as we move forward to be able to reach those people in the inner cities and in the suburbs. You know, the mom gets home after work at 5 and she wants something quick and easy to fix her kids. And, you know, I think these ready-made meals that the beef checkoff is putting the money in for the research is going to be a crucial part of this business as we move forward.
I think that we need to put a little bit of the money that we've earned in this business back into this industry. From my standpoint, looking to the future of the generations of my sons, my grandchildren, and those type people, that we got to promote what we do. That from the beef checkoff standpoint, they did a wonderful job of doing that over the years for the next generation.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Still using ineffective fly tags on your cattle? It's time to eliminate fleas, ticks, flies, lice, and parasites, and at the same time, give them a shiny coat, making them more valuable. One fly tag can cost $2.50, but you can do this all for about a nickel a head. Introducing the Cow Sprayer, designed and built in the U.S. The Cow Sprayer is portable, solar-powered, and comes with a 25 or 40-gallon tank. Eliminate parasites for about 5 cents a head with the Cow Sprayer. Cowsprayer.com.
It's easy to spot the man who uses Synanthic. With lower volume and less waste, Synanthic steps up your deworming routine. Get more deworming with less dewormer at Synanthic.com.
Beringer Ingelheim Vetmedica Inc. knows the importance of beef quality assurance and asks you to step up and get certified. Go to bqa.org for details.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner, and we're talking about getting the calf out of the cow. And calving season is upon us. There's a lot of excitement. Dr. Miesner is an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine, where he sees hundreds of cows a year, teaches this. We're fortunate to have him as a guest. It's always good to have you on the show. Always, you bring great wisdom and you do a good job, not only with our clients and their animals, but I'm very thankful for what you do for our students.
Appreciate it.
Appreciate you. Let's talk a little bit, Matt, about the post-calving care, and we got to get to that third stage, right?
Right. So we've got the calf on the ground, and sometimes there's some intervention that needs to be done right then and there, as far as resuscitating that calf, and even a slight delay through that pelvis can get them short on oxygen and different things. And so there's a situation sometimes where we've got to intervene within that first 5 minutes, and we have various drugs and treatment protocols that we kind of follow with that. Get them breathing, get some air passage, and then kind of watching the cow as well. So did we have some rough birthing where we have to address some injuries to the cow? Address those right then and there. So that first 5 minutes to an hour is just getting that calf viable and able to sustain itself. And then after that, down the road several hours, the cow should be passing her placenta within 6 to 12 hours, but sometimes they'll retain. And then within that first hour or two, we really want that calf to have its first meal of colostrum too. So either he's going to be viable enough to get up and do it himself, or sometimes it's just easier just to go ahead and strip her out and tube it right then and there, or get him to take a bottle.
And the sooner the better on colostrum, right?
Right. You're within a 24-hour window, long window. I mean, ideally within 6 or 8, they need to have that first bit of colostrum to be absorbed. And then after that, things start shutting down and they don't absorb it systemically after that. So within that first 6 or 8 hours.
What's your stance on retained placentas? Because I mean, my granddad and dad, we made 100 calls a year on retained placentas.
Right. We want her to pass it on her own at all costs. We don't really want to force it out and strip it. That still shows that causes quite a bit of inflammation. So she might retain it. We treat her, support her, antibiotics sometimes, depending on how healthy she is. But most cows will eventually, get that to loosen up and fall out. It can be pretty horrendous by the time it comes out. But as long as she's healthy, I let her do it on her own. We can do some gentle help, but we don't want to clean them.
Cool. Well, thanks for being on the show today.
Thanks for being here.
Folks, thanks for watching DocTalk. And if you want to know more about what Dr. Miesner and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with your local practitioner on many of these issues. Thanks for watching DocTalk today. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by MERCK Animal Health, the science of healthier animals.